What if the person you love most was silently suffering from generalized anxiety disorder and you didn't know how to help? Imagine your dearest family member constantly living in a state of endless worry and fear without you even realizing it. Don't let fear and helplessness dominate you. Watch our video and learn how to identify generalized anxiety and know when to see a doctor, even without experience in the subject. And if you're not yet subscribed, subscribe to the channel and activate the bell so you don't miss any content. Watch this video and you will be surprised at the end. You will learn what it is, how it affects society, risk factors, initial and most common symptoms, diagnosis and treatment options. Understand how to deal with this condition and how to support someone who suffers from it. So what is generalized anxiety disorder? It is a disorder characterized by excessive and uncontrollable worry about various everyday issues. People with generalized anxiety disorder often feel anxious and tense, even when there is no clear reason to worry. This anxiety can significantly interfere with everyday life, affecting work, school, and personal relationships. How prevalent is generalized anxiety disorder in the population? It is estimated that around 3 to 6% of people will experience GAD at some point in their lives. This disorder is more common in women than men and can occur at any age, although it often begins in childhood or adolescence and continues into adulthood. What can increase the likelihood of developing generalized anxiety disorder? Several factors may contribute, including genetic predisposition, stressful or traumatic events, chronic illnesses, and chemical imbalances in the brain. Additionally, certain personalities who are naturally more sensitive to stress and anxiety are also at greater risk of developing the condition. How to identify the first signs of generalized anxiety disorder? Initial symptoms often include constant and excessive worry about various activities or events. Other common signs are restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep problems. These symptoms can vary in intensity and may worsen during times of stress. If you are enjoying this content, leave a like and comment below what you find most interesting. Don't leave the video now as we still have more amazing content for you. What methods are used by healthcare professionals to diagnose generalized anxiety disorder? Diagnosis usually begins with a complete clinical evaluation, including medical history and physical examination to rule out other medical conditions. Screening questionnaires and structured interviews help identify symptoms and assess their intensity and duration. Specific criteria, such as those from the Diagnostic and Statistical Manual of Mental Disorders, are used to confirm the diagnosis. What are the treatment options for generalized anxiety disorder? The most effective approaches include therapy and medication. Cognitive behavioral therapy is often recommended and helps identify and modify negative thought patterns. Medications such as selective serotonin reuptake inhibitors and anxiolytics may be prescribed to alleviate symptoms. In addition, relaxation techniques, physical exercise, and lifestyle changes are also useful in managing anxiety. How can society support people with generalized anxiety disorder? It is essential to raise awareness about the disorder and offer emotional and practical support. For family members, it is important to be understanding and patient, encouraging treatment and avoiding judgment. Joining support groups can provide a safe space to share experiences and get helpful advice. And tell me in the comments, what theme would you like to see in the next videos? Thank you very much for watching this far.